Hello, I'm Dr. Lorance Peter, consultant gastroenterologist and hepatologist in Columbia Asia Hospital, Sarjapur Road. Today, I will be talking about a very common problem of fatty liver disease. You may be aware that many of us in the community, especially elderly people with little obesity or diabetes, they all suffer from fatty liver. The next few minutes, I will be talking about what is fatty liver, how important is this, and how much is the amount of disease present in the community, how is this disease generated or pathogenesis of the disease, how do doctors make this diagnosis, and what are the usual tests done, and what does it mean, and how can we treat it, and how can we prevent it. So, the fatty liver, or what we call as non-alcoholic fatty liver disease, is a worldwide epidemic. The last 10 years, there has been increasing incidence of fatty liver to the extent of up to 20 to 30% of people in the community in some countries have fatty liver detected by ultrasound. The prevalence is increasing in parallel with rates of obesity, diabetes and metabolic syndrome. Metabolic syndrome is nothing but obesity, hypertension, diabetes and insulin resistance. And it is estimated to affect as many as a third of general population, up to 70% in diabetic and obese subjects in United States. In India, it's around 30 to 35%. By definition, a fatty liver is defined as more than 5% of the liver cells or liver having fat on biopsy. And what is wrong with this fat? This fat can cause liver cell injury, liver cell inflammation and liver inflammation, and finally there is a spectrum of disease from minimal fat to more fat, inflammation, fibrosis. Fibrosis means scarring, and scarring leading to cirrhosis. So if you see subset of people with fatty people, obese people have around 51% of them have fatty liver, and diabetic people have around 22%, and people with high cholesterol and triglycerides have around 70% of them have fatty liver. People with hypertension have around 39%. It is also seen in children, with some studies estimating a prevalence rate of 3 to 18% of children having fatty liver. And nowadays, if you look at that, fatty liver is becoming the commonest cause of liver cirrhosis, end-stage liver disease, and even liver transplantation. So, you have a spectrum of disease. You have a bland fat without much inflammation, which is detected on an ultrasound. Normally, they have no much symptoms, and some of them do have inflammation, which is reflected by an abnormal liver functions or other markers. And then gradually, the spectrum, the injury increases and the scarring increases, and you get fibrosis or fibrin deposition, and it leads to F1, F2, F3 or F4 fibrosis, and frankly, finally it becomes cirrhotic, which is a scarred, shrunken liver. And this liver cirrhosis can cause decompensation in the form of water accumulation in the stomach, called ascites, edema, and portal hypertension related variceal bleeding, blood vomiting, and finally liver failure. So, what are the likelihood of fibrosis and NASH in patients with NAFLD? So, we need to know, if you find fatty liver on ultrasound, what are the chances that this patient is having a significant problem, or it can be kept aside. One, there are a few predictors. So, if the age is more than 50, if it is associated with diabetes, obesity, blood pressure, and elevated AST, and a fibroscan, which is a very simple technique where the scores are more than 8.5, and also there are some scores like NAFLD fibrosis score based on simple test, and there is another called FIB4 score. These things, FIB4 score more than 2.67 or a NAFL fibrosis score more than 0.67. These are all doctors can calculate the scores based on your blood test. And then these will tell you that, okay, you are having significant liver disease. If the fibroscan is more than 8.5 or the enzymes are elevated. So when the patient comes, doctor will do some tests, including the liver function test, ultrasound, a fibroscan to look at how stiff is your liver, is there any chances of fibrosis setting in, and also many tests which will include your height, weight, and diabetes, HbA1c, triglycerides, thyroid functions, fatty lipid profile, all those things to see what are the underlying processes which are leading to this fatty liver. And there are many portals where you can put these numbers in the internet. There are some sites where you can put these numbers and can get you a score which will tell you whether you are likely to have more fibrosis or more serious liver disease or not. And once we have a fatty liver patient, we need to ask few questions as doctors and ourselves. Is this fatty liver is NAFL or non-alcoholic fatty liver disease or something else? So what else can present as fatty liver? Alcohol obviously can present with a fatty liver. Some of the drugs can cause fatty liver, and Wilson's disease, hepatitis C, autoimmune liver disease, all of them may also look like fatty liver. And how to differentiate a silent, non-troubling or innocuous fatty liver versus a progressive disease? In that, the fibroscan, your blood test, all those things are helpful. And is there any reliable method of doing this test? Because the best method is by doing a liver biopsy. But liver biopsy has got its own problems. Many people don't accept it, and there are small risk of bleeding. So, and it's an invasive method of putting a needle inside and taking it. But I tell you, this is not a very problematic thing. Liver biopsy can be done safely. But do we have any reliable, non-invasive assessment of liver fibrosis? Yes. Fibroscan, FIB4 score, NIFS scores, all of them help us. And is liver biopsy necessary? Yes, definitely. We should do liver biopsy in some people, few people whom we feel that the liver is significantly involved. Not for all patients with fatty liver. If it is other risk factors are not there, then there is no need for liver biopsy. So liver biopsy is indicated in whom we feel there is significant liver involvement by looking at other metabolic factors and also looking at the scores, the FIB4 and NAFL score, and all those things will help us to find it. So in summary, we diagnose fatty liver by ultrasound, and we do tests to find out, is this fatty liver simple fatty liver or is it causing liver damage? So for that, we will do the above mentioned tests. Now, how do we treat these people? There are no single drug which is going to treat your fatty liver and take the fat away. So basically, it is lifestyle changes. It's a lifestyle disease. It is a disease associated with the diabetes, metabolic syndrome, overweight and lack of physical activity. So we need to have lifestyle changes, and which will be predominantly, and that is exercise and calorie deficient diet. Calorie deficient, around 400 to 600 calories deficient. It's around 1000 to 1200 kilocalories. Low fat, low carbohydrate, high protein diet. Or even intermittent fasting is also found to be good and useful in some people with fatty liver, especially when they are not diabetic. And it is more useful in pre-diabetic people. So lifestyle changes are the foundation of any treatment plan. But the problem with lifestyle changes are it is difficult to sustain and achieve the targets, especially with the calories and the weight loss. It's difficult to sustain. So many people find it, difficult, and there is not. And many times the lifestyle changes may not be enough for in obese people. The most important lifestyle change is weight reduction. There is enough evidence to say that if you lose around 3% of body weight, the fattiness reduces from 35% to 50% of fattiness in the liver can reduce by reducing 3% of the body weight. And weight loss more than 5% is associated with decreasing in liver inflammation and liver swelling. And weight loss more than 7% is associated with complete resolution of the inflammation. And more than 10% even the fibrosis can regress from a higher grade of fibrosis to a lower grade of fibrosis. So, if you look at the group of people with the fatty liver, basically the basal level of their exercise levels are low, and they use around less than 20%, they only meet the recommended daily exercises. And 50% of patients will report no physical activity at all in fatty liver. So it's very important to stress exercise, and it should be vigorous intensity exercise, that is more than 6 minutes for 75 minutes per week, associated with a decrease, and it decreases the odds ratio of developing NASH at 0.65. And diet also, we should cut down on sweets, fat, and control of diabetes. Underlying diseases like triglycerides or cholesterol has to be treated with statins or appropriate drugs, and the diabetics have to be treated. And what are the currently available medications used in fatty liver? There are some new drugs have also come. The old drug is vitamin E. The vitamin E is used in the dose of around 800 milligrams per day. It reduces liver inflammation, it normalizes the liver enzymes, so it is used as an adjunct therapy predominantly in fatty liver. Vitamin E is used in fatty liver. It has shown that it reduces the liver enzymes, elevated SGOT, SGPT, and resolution of some inflammation happens. But in 50% of patients it doesn't work. And there have been concerns about long-term safety of vitamin E, especially with hemorrhagic stroke and prostate cancer risk. But a recent analysis have shown these risks are unwarranted and this is quite safe drug to use. The other medicine which is used is a diabetic medication called pioglitazone. Pioglitazone is used in patients who are diabetic, who are having fatty liver. It is to use. It has some side effects like water retention and other issues. Then you have a lot of medications like elafibranor, fenicriviroc, and cimitumab. Many drugs have been tried. One of the promising drugs which has come recently is a PPAR alpha gamma agonist called saroglitazar, and it is useful in treating. It reduces cholesterol and triglycerides. It reduces liver inflammation, and it reduces blood glucose levels, and it gets you better HbA1c levels. And also it reduces the lipoprotein metabolism, fatty oxidation, and triglyceride accumulation in the liver. And it also reduces Kupffer cell activation by reducing cytokine releases, and it reduces stellate cell activation, and which finally causes liver fibrosis. So saroglitazar is a promising drug which has shown to reduce liver inflammation, reverses NASH, and reduces fibrosis, and improves glucose metabolism, glycemic stage, and HbA1c, and also it improves the lipid profile and triglyceride. Another promising drug which has come into the market recently is obeticholic acid. It's a fascinoid receptor agonist which interacts with the bile acid metabolism. It has been shown that it reduces liver inflammation and fibrosis, and it is used especially for reversal of fibrosis in patients with NASH, fatty liver. But it has some side effects. It causes increase in triglycerides and cholesterol, so you may have to combine it with other medications, and some people can experience itching because of that, which can be managed by reducing the dose of the medications. But it is promising in a subset of patients who have fibrosis, where it can be used to reduce the fibrosis. So in summary, fatty liver is a very common problem. It can be a naive, non-disturbing problem, or it can be a severe disease which can progressively damage your liver and lead to liver cirrhosis and liver related problems like ascites and decompensation of portal hypertension. The main key treatment is by exercise and weight reduction. And other pharmacological therapies are aimed at addressing the underlying problems like diabetes, dyslipidemia. Of the many drugs, saroglitazar and obeticholic acid and vitamin E are the mainstay of treatment for people with fatty liver. Thank you.